My question is, how would you improve community healthcare in order to reduce pressures on the NHS?
Can we start with Jeremy from Gwynedd, please?
Community healthcare. A lot of the problems we're getting are the blockages, the bed blocking, which is a horrible thing to say, but so many, we're not associating the NHS with our housing policies. And we have so many people who are in hospital and can't be released because their homes aren't suitable. So we have got to combine those two together, looking towards the future, where elderly people are situated or located within suitable accommodation, closer to hospitals, closer to clinics. That hasn't been taken into consideration. I know we look towards social housing, but we've got to look at a fuller programme, looking at the journey of life that we all take, starting maybe from small accommodation, but as we get older, and that is creating a huge problem within NHS at the moment. Likewise, with the primary care, the clinics, the GPs, they're struggling. The amount of calls they're receiving, the appointments they're receiving is becoming a problem. I do foresee that AI will come into play as we move on. It's not something that everybody agrees with, but the appointments process is something. But looking generally within the NHS, I do believe we're situated within the Betsy Cadwallader. We were in 5 years of special circumstances from 2015 to 2020, and yet again 3 years, so 8 years. I do think we're in a emergency situation, and I do think if we want to get rid of that bow wave, we have to address it as that. I don't think the current government, Labour, will recognise that and accept it, but I think come May, I think that we should do that and get ahead of it so that we can reduce all these lists.
Thank you, Jeremy.
Yeah.
Appreciated. Okay, can we have Monty Independent, please? Monty Kennard, Independent.
Yes, I want to sort of reinvest in the idea of community hospitals. I live in Chirk. We've got a community hospital just down the road, and it's fantastic. It's a really useful resource. The same for minor injuries units. Sort of reduce the pressure on emergency A&Es in the hospital. They're a really useful resource, but they're kind of difficult to access at the moment. I want to improve sort of the digitization of the healthcare system. It's very patchy at the moment, and along with that comes barriers within communication between different services, and I think that needs to be streamlined and to make it more efficient. The hospital often doesn't talk efficiently to the doctors, who doesn't talk efficiently to the nurses, the community nurses, and etc. I think investment needs to continue into resources for people to live and stay in their own homes. I've got elderly family members who really benefit from not only people that are able to come in and support them, along with sort of the physical resources and adaptations that can happen to their housing as well. Thank you.
Diolch yn fawr. Thank you, Commissioner Lead, that. Can Sian Gwenllian from Plaid Cymru, please?
Thank you for the question. And improving community healthcare is key to improving the NHS and to improving the health outcomes of our population. We are saying that we would restore the GP recruitment drive. We would be looking to employing 100 new GPs in our practices in our communities so as to alleviate the pressures on the hospitals. I have been campaigning successfully for a new medical school for the north of Wales, based at Bangor, which is actually training 80 new doctors per year by now. It was a long campaign. Labour didn't want to see us establish a medical school for some reason, but it has happened. And soon we will see some of these young people, lots of them from our area, getting jobs in the GP practices. The workforce itself, the social care workforce, really needs to be prioritised and valued. At the moment, they're not paid enough, and there are massive recruitment problems within the social care sector, but they are doing such a wonderful job, and we need to emphasise that. Unpaid carers as well, the underestimated work of unpaid carers that enhance the health of our population, especially the elderly population within our communities, keeping them within their own homes. Thank you.
Diolch yn fawr from Gwynedd for that. And last but by no means least on this question, Alan Davies, Conservative.
Thank you, and thanks, June, for the question. Community care is fundamental to the health service. In my own ward in Llanrhaeadr y Mochnant, the GP practice is likely to close the clinic there. It will have a really detrimental impact on the community. The GP services provide fantastic services, from end-of-life care, palliative care, and they're really innovative, but they are, have a practice for over 12,000 residents, over 10,000 square miles. Not, yeah, well, I'm not sure it's 10,000 square miles, or I'm getting my numbers wrong, but it's a huge area in North Powys, one of the most rural areas in the whole of Powys. And Jeremy and Monty make really important points around healthcare, the IT, the ability to use IT to improve the delivery of services. And Sian does talk about the importance of the workforce as well. One of the Conservatives' ideas is to refund the tuition fees for doctors and nurses and dentists who stay in Wales and work in Wales for 5 years post-graduation. But there are so many, a friend of mine, his 2 daughters are qualified doctors, and they are going off to Australia just to because they cannot find the posts here in the UK. We have to ensure that our newly qualified doctors can continue in that learning development, and so to stay within their community and they're loyal to their community. It's really important that happens, especially in rural Wales.
Thank you much indeed for that.